Welcome to week 5, chapters 4 and 23. Because case managers have become an integral part of the medical mainstream, it is essential that new dialogues and heightened levels of communication be maintained. Case management is a person-to-person service, and open pathways must be laid for good interaction. More focused and conscious communication is needed between case managers and physicians, patients, families, payer sources, and related legal entities. To communicate effectively with each of these groups, case managers must recognize the obstacles to communication and strive to overcome them. Physicians tend to be results-oriented, trained to diagnose and treat with only one episodic patient involvement. Case managers, who usually come from traditional caretaker professions such as nursing and social work, maintain ongoing patient contact to perform their functions. Therefore, from the onset, case managers tend to view physicians as being less interested in their patients, whereas physicians tend to regard case managers as being overly involved or downright obstructionist. There are also gender-related disparities that contributed to communication challenges. The now commonly heard expression, he said, she said, has particular significance in the physician case manager dialogue. The healthcare system itself is another obstacle to case manager physician communication. Churning the change is an unwittingly pitting healthcare professional against healthcare professional. With the bureaucracy collapsing around them, physicians view case managers with a weary eye. In addition to issues of control, there are issues of cost control. Misperceptions and misunderstandings stem from the emergence of the 1980s of cost containment as a factor influencing healthcare delivery. Necessitated by advancing medical technologies with advancing price tags, a long-lived population requiring care, and a shrinking pool of dollars funding both general and high-tech treatment, managed care practices have placed case managers and physicians in uncharted territory. Neither group of professionals is accustomed to considering, much less negotiating, the cost of care. Certain cases by nature of their circumstances might automatically cause a physician to be on guard regarding the case manager's intent. For example, a case manager may be called upon to intervene on behalf of a patient who has been in the acute care setting for 3 weeks and for whom new healthcare settings are being explored. The case manager needs to relay that there is a concern of the patient's limited policy and that he or she wants to work with the physician to make better use of the patient's benefit dollars so the funds will be available for a longer period of time. The communication is upfront and professional, and the case manager's role is clearly defined. The more secure case managers are in their role, whether speaking with physicians, hospital discharge planners, social workers, or patients, the better able they are to convey their objectives and all necessary information. In working with physicians, case managers need to make it perfectly clear that their first and foremost concern is for the patients, and that their interest is ensuring the highest quality of care and the best possible outcomes. In addition, physicians must be assured that the case managers are not there to control or dictate patient treatment plans. Instead, the communication between the two groups should create an atmosphere of cooperation and collaboration. Case managers, after all, possess a different knowledge base than physicians, which are examples of understanding a patient's insurance policies, as well as information about various community resources that may be accessed to affect better outcomes. The means by which case managers acquire cases often dictate the order in which the exchanges with the physicians will proceed. Typically, the case manager first contacts the patient or family, then the treating physician. In making the initial contact with the patient, the case manager may gain valuable information that can later be passed on to the physician. By understanding the importance of effective physician contact and properly timing dialogues, the case manager is more likely to make a real contribution towards a successful outcome for the patient. Case managers can put several practices into play to better their working relationship with physicians and improve the standing of the entire case management community. The timing of patient referrals to case managers will describe how the case manager's role should be introduced and explained to the patient or family. To facilitate the best possible exchange, the case manager needs to have as many facts as possible about the patient and the reasons for the referral. The case manager should be aware that the patient and family may be experiencing much more than a medical crisis and take the time to consider the patient and family's feelings. Our healthcare system has become a very paternalistic one. We believe we know what's best for the patient's needs, but we assume this without input from the patient. From a patient's perspective, a good scientific outcome may not be relevant. Patients do not have access to clinical research data. They are not familiar with care maps or care pathways. Have we asked, are you comfortable? Did you understand why this was recommended? Do you want to die at home? A case manager should interview the patient and family members for their expectations regarding the future. If you lose the family, you lose the patient. Many medical cases, particularly those of catastrophic nature, will devastate a family. In tough medical situations, all attention is focused on the ill or injured person, even though the caretaker family members might be hanging from a thread. Case managers must understand that their roles include advocacy for the families. Case managers should document all of the patient communications, whether in person or telephonic, regardless of the patient's acceptance or refusal of services. Beyond chronicling a case manager, patient exchange or correspondence can be used to reinforce important messages. Communication should flow between case managers and patients and families whenever appropriate. At the time of referral, after the referral, when the new information becomes available. The correspondence should reinforce and redefine the role of the case manager. Each payer, source, or line of insurance places certain restrictions or obligations on the case manager. For instance, workers' compensation is one state may mandate the case manager perform stipulated duties in a set time period, use specific forms, apply stated criteria and an evaluation, and charge only a fixed amount. In other cases, the case manager has to listen very closely to what the payer is requesting and not begin a program that he or she considers ideal. Specifically, what does the payer expect? What are they asking for? The sentiments of communication must be clarified. Case managers can clarify a number of issues for employees to keep them better informed regarding case management and its benefits. One way to delineate the benefits of case management to employers is to highlight its risk management contributions. The value and benefit of case management also needs to be communicated to the employee. The clear exploitation of the case manager's intent and role, along with an honest and straightforward manner, goes a long way toward overcoming an attorney's concern regarding case management intervention. Anticipating questions, all communication should underscore the case manager's proactive involvement in a complex delivery system. Simply because of the nature of the work, most case managers' caseload consists of tragic cases. Many are of life and death situations. The bulk of them have to deal with not a happy ending. Despite the day-to-day challenges, case managers need to maintain their equilibrium and a strong sense of their role. Otherwise, they will become overwhelmed and burnt out. To prevent burnout, a case manager would do well to understand the parameters of the job and not glamorize it. An RN trying a utilization review or case management role needs to prepare the role's requirements. Many professions have hazards, and recognition of them is 3/4 of the solution. Chapter 23, the case manager's role in the era of value-based healthcare. As more providers focus on maximizing their clinical outcomes, it will become important on case managers to deploy better processes to help providers demonstrate their focus on value-based healthcare. Case managers will need to leverage best practices in healthcare informatics to benchmark and document regular clinical measurements and record performance and outcome improvements. Case managers are expected to work within a framework of established quality and performance measurement systems and parameters driven by legislation, including the Medicare Modernization Act of 2003. In 2011, after the passage of the Affordable Care Act, the Triple Aim Quality System was established as the foundation of the National Quality Strategy. The three goals in the Triple Aim system are improving the individual experience of care, improving the health of populations, and reducing the per capita cost of care for populations. An area of clinical measurement in which a case manager's role is especially crucial is patient-reported outcomes, also known as PROMs. Within this metric is the patient experience, communication, a patient input regarding his or her improved health and well-being. These subject metrics are in contrast to other objective clinical parameters, such as hospital-acquired infections, readmissions, mortalities, and changes in blood pressure, cholesterol, or blood glucose levels. PROMs have been widely adopted across the United States, despite the fact that in 2004, the National Institute of Health established a patient-reported outcomes measurement information system, also known as PROMIS. Its goal is to facilitate more precise measurement of patient-reported information so that information can have more relevant application in clinical practice. Within the context of PROMIS, case managers play a vital role in helping patients articulate their healthcare experience, needs, and goals. Within the broader scope of helping providers demonstrate their care efficiently through clinical outcome measurements, case managers are charged with implementing proactive care plans and documenting the patient's progress under these plans. How effective healthcare providers are in benchmarking clinical performance lies squarely in the ability to enter into the value-based contracting arrangements. Specifically, unlike fee-for-service contracting, value-based contracts involve payments and reimbursements based on predefined value criteria, including patient health outcomes, quality of care, and delivery of care efficiencies. Healthcare systems, hospitals, physician groups, and other providers in value-based contracts are paid for providing services to specified patient populations at predetermined prices and quality level. In these arrangements, the participating providers assume a greater role in population health management, requiring the diligence in identifying high-risk patients and providing effective case management and disease management for patients with chronic and multiple conditions. There are several value-based models: shared saving models, care management fees, bonus model, pay-for-performance models, bundle payment episodes of care model, PCMH, shared saving model, share risk model, capitation full risk model, and provider-sponsored health plans. Case managers need to recognize that value-based models are changing the landscape of how hospitals work with other providers and payers, and the case management has a significant role in the changing landscape. Case managers are on the front line of value-based models. Price transparency is not without its challenges. Both providers and patients struggle with the wide range in prices for the same tests and procedures. There is also the convoluted manner in which medical bills are prepared, making it difficult for patients to know what their cost is. The success of price transparency initiatives is vital to the long-term success of value-based healthcare. As it stands now, many believe we have a long way to go until transparency is the rule rather than the exception. Case managers can serve as educators and advocates for patients, helping them gain price information and estimates in advance and make informed decisions to access high-quality care at competitive prices. As for bloated billing, case managers can help patients decipher their share of bills and the expenses covered by insurance. The Case Management Model Act, which presents the core components of comprehensive case management program, supports the objectives of value-based healthcare. Specifically, it imparts the role of case managers as facilitating cost-effective strategies that promote better quality, improve outcomes, fewer readmissions, and fewer consumer satisfaction.